Hello everyone, you're welcome to Dr. Bones YouTube channel. I hope you all have been doing great. Today we'll be discussing a very important topic that is of great concern to a lot of women. Older women, and it's no other than menopause. Today we'll be discussing the symptoms of menopause, premenopausal changes, and management. So please, if you are just tuning in to Dr. Bones YouTube channel for the first time and you have not subscribed, please click on the subscribe button, as you'll be getting a lot of notifications on very interesting health topics and you'll be glad you subscribed. As a way of introduction, we'll be talking about a story, talking about a lady who is in her 40s, late 40s, who usually wakes up at 3 a.m. every day, and she was wondering if she was beginning to lose her mind. Does this sound familiar? Please, if you are watching this video, chances are that you or someone you love is navigating this mysterious journey of menopause. So you are not alone. Please pay a lot of attention, as it will be of great benefit to you. Please like, share, and also subscribe to Dr. Bones YouTube channel. We are also on TikTok, so you can reach us there as well. In few minutes, you will discover the 3 phases of menopause, as sometimes this, due to time constraints, doctors are not able, or some doctors are not able to explain this clearly. We'll be talking about them, and then the management of this transition, naturally as well as medically. We must first of all know that in understanding the menopause journey, menopause isn't just about your periods stopping. It's something crucial we must first take note of, that menopause isn't just about your periods stopping, that it's rather a journey with 3 distinct phases, and understanding this changes everything about how you approach menopause. Please, we shouldn't take these facts for granted. The first phase of menopause is what we call the perimenopause. This is like an invisible phase. There was this patient also in her 40s who came saying, "Doctor, I think I'm growing crazy," because her periods were still regular, but she was experiencing a lot of mood swings, brain fog, and weight gain. She was basically in this perimenopausal phase, which we call also the invisible phase, because she was in her 40s, early 40s, let's say 42. She didn't know that she was already perimenopausal, or in the perimenopausal phase. She thought she was going crazy, and she would always come for counseling in the hospital. So this perimenopausal phase, we must know it can start 8 to 10 years before the menopause itself. During perimenopause, the estrogen levels are like a roller coaster. Today it's high, the next day it is low. This explains why the woman might feel amazing one week and terrible the next week. The key signs are what we have talked about or mentioned. You can want to ask yourself, as a woman, have you noticed irregular periods, sleeping? Your sleep has changed. That means you're having sleep changes or mood shifts in the past year. Don't worry, we'll come back to that. We've just tackled the perimenopausal phase, that those women sometimes feel funny, and this is as a result of the changes in the estrogen levels. It's not something that cannot be managed, so you just report to the doctor and then it will be taken up from there. We move over to the menopause proper. Menopause, we must know, is technically just 1 day, 12 months after a woman's final period. But here's what most people don't realize, that the symptoms of menopause peak during the perimenopause, not during this menopause itself. All the weight gains, and all of that, they start happening during the perimenopausal phase. Then we move over to the third phase, and that is the new normal, the post-menopause. This is the rest of the life of the woman after her menopause. It can be incredibly empowering when you know how to thrive in it. We move over to the second section of this discussion. You remember the lady we talked about, that her nights sweats were just the tip of the iceberg. Let's share the symptoms that often start years before anyone connects them to menopause. The surprising symptoms. So the early subtle signs that can start from age 40 to 45 is number 1, sleep disruption. The person falls asleep fine but will wake up between 2 to 4 a.m. with racing thoughts. These early subtle signs starts when the person is between the age of 40 to 45. You are noticing that you are having sleep disruption, you fall asleep, but you wake up in the middle of the night and with strange thoughts. This isn't stress, it's dropping progesterone levels. If you are this age, we have mentioned 40 to 45, and you're having this experience, please don't feel like it's something that cannot be managed or there's something wrong with you. Just report to the hospital, you see your gynecologist. Number 2 subtle sign is that there's estrogen fluctuation affecting a person's neurotransmitters, and there's brain fog. But this brain fog at this time is not aging. They are all subtle signs of menopause. We say the first one that the woman will experience, especially a woman in her 40s, between age 40 to 45, they have this sleep disruption and then brain fog. Sometimes the woman may wonder, if she has a car, where did she put her keys and all of that? It's as a result of the brain fog, especially because of the estrogen fluctuations affecting the neurotransmitters and all of that. We move over to the third subtle sign, weight gain around the middle part of the woman. Even though nothing in her diet changed, her metabolism is shifting as the hormones are declining. Then the obvious signs. So please, before we continue, you can drop your comments, you can drop your questions, and then we'll address them. So the obvious signs from 45 to 55 years are the hot flashes and night sweats affecting 75% of women. This is the one most of the women talk about, hot flashes, night sweats. These are all obvious signs of menopause. But here's what makes them manageable. Understanding your own personal triggers. Every woman has her own personal trigger. So you must understand your personal trigger. In as much as some of the signs and symptoms are general, a lot of women have their own personal triggers, which we must understand. Some of these split triggers include mood changes that feel like emotional whip splash. A patient told us that she cried at a dog food commercial, then screamed at her husband for breathing too loud. This is normal and it's temporary. So there's this mood, they have mood changes. Some can have joint aches and pain. Estrogen helps maintain joint health. As it declines, you might feel your age 10 years overnight, because estrogen is a very important hormone that helps with joint aches and pain. Like, it helps to maintain joint health. If the woman starts feeling joint aches and pains, just means that the estrogen in her body has started declining. It's also something to look out for. Then the intimate change is often unspoken. Let's talk about something many women whisper about but rarely discuss openly, as the vaginal dryness and changes in sexual health. This affects up to 90% of postmenopausal women, yet is treatable and manageable. Urinary symptoms like urgency, frequency, or recurrent infections can also happen. These aren't just getting older. They are hormone related and have solutions. Then long-term changes, for instance, bone density changes, heart health considerations, and skin changes. These aren't just cosmetic, they are health priorities that we need to address proactively. So we'll move to the third section of this discussion on menopause. Remember, today that is the topic we're talking about. Management strategies. that actually work. Here is the empowering truth. You have more control over this experience than you've been told. We'll share 3-pillar approach that helps thousands of women feel just like themselves again. First, the first pillar is a lifestyle foundation. What you eat. We always talk about what you eat in our videos on Dr. Boom's YouTube channel. What you eat. Your nutrition is very important to your health, even as it regards menopause. Focus on protein at every meal. Ensure you have protein in your diet, in your food, in all your meals. That will also help you. Aim for at least between 20 to 30 grams of protein in your meals. If I will advise, you can do more of fishes and all of that, because you take fishes, you take chicken and all of that. You can cut down on cow meat and all of that. So processed meat and those kind of things. Eat healthy, because your body needs more protein during this transition to maintain body muscle mass and stabilize blood sugar. You must exercise. Inculcate exercise into your routine, your daily routine. Strength training twice a week is non-negotiable, not just cardio lifting weights, because this protects your bones and boosts your metabolism. You must take exercising serious. You must eat a lot of protein, healthy protein, because this all help to keep you functioning optimally even as you are in menopause or postmenopausal. Sleep hygiene. Keep your bedroom cool and conducive for sleeping. Invest in moisture weekly sheets. Consider magnesium supplementation. Yes, this will all help. The second pillar is natural support options. For instance, black cohosh for hot flashes. Research has shown that it can reduce the frequency by up to 50% in some women. This black cohosh to help in hot flashes. Omega-3 fatty acids as well for mood stabilization and joint health. Aim at least for 1,000 milligrams daily omega-3 fatty acids. They will also help. Then adaptogens like ashwagandha for stress management and sleep support. So if you can get in contact with all these things, they are natural support options. They are also going to help you in the journey of menopause. So for intimate health, coconut oil or vitamin E oil can provide natural moisture. So you apply it regularly, not just during intimacy. Coconut oil or vitamin E oil. It will help in your intimate health. So pelvic floor exercises too aren't just for pregnancy. They also help during menopause with bladder control and sexual function. So we are also encouraging you, if you can, to do pelvic floor exercises, as this will also help. Please always consult your healthcare provider before starting any supplement, especially if you are on other medications. Please, this is very important. So we move to the third pillar, medical interventions. Hormone replacement therapy isn't right for everyone, but for many women, it's life-changing. So the key is finding a provider who understands individualized treatment. We are talking about the third pillar for managing this situation, menopause, like medical intervention, where you'll be given hormone replacement therapies. So this can also help. So for hot flashes and night sweats, non-hormonal options like gabapentin, clonidine, or certain antidepressants can reduce hot flashes by about 60%, between 40 to 60%, as well as vaginal moisturizers like Repellent or Good Clean Love can also be used regularly, while water-based lubricants can help during intimacy. So for recurrent UTIs, sometimes low-dose antibiotics or cranberry supplements can also prevent infections. Then for mood or sleep, the SSRIs or SNRIs, they are not just for depression. They are medications for but they are not just for depression. They can also help with mood swings, hot flashes, as well as sleep quality. Melatonin for sleep, but timing matters. You have to take it at least 2 to 3 hours before your desired bedtime. Always, like I said, consult your doctor or take all these medications and all of that. For bone and heart health, calcium and vitamin D3 supplementation, but also weight-bearing exercise is very crucial. Like we said, don't joke with your exercise, and you can inculcate taking in calcium as well as vitamin D3 supplements. Regular monitoring, bone density scans, lipid panels and all of that, and cardiovascular health checks become even more important at this phase of life. Then you have to create your own personal action plan. So if you are, for instance, to give you an example, if you're in early perimenopause, focus on lifestyle foundation first. Track your symptoms with an app like the Clue or Flow app. This data, it will help. It's going to be invaluable when you talk to your doctor. So at least you start by focusing on lifestyle foundation first. If you are in active menopause, don't suffer in silence. Make an appointment with your gynecologist, menopause specialist, or a provider familiar with hormone therapy. Come prepared with your symptoms tracking. So it's good to track your symptoms. Track your symptoms, like I said from the beginning. Some symptoms are peculiar to individuals. If you are also post-menopausal, focus on long-term health, bone health, heart health, and maintaining the lifestyle changes that made you feel better. Interactive element. We have been able to give you a guide. It's up to you now to download it and then start tracking. Download these apps we've told you about as well. Start tracking your symptoms, because knowledge is power, especially when it comes to your health. Remember the lady we told you about in her 40s who couldn't, in her late 40s, who wasn't really sleeping very well. 6 months after implementing these strategies we have talked to you about today, she's sleeping through the night. Her energy is back, and she's told us that she feels like herself again. Actually, she feels better than she has ever felt in years. So menopause isn't a disease to be cured. It's a transition to be navigated with wisdom, support, and the right tools. So please, if this video has helped you feel less alone or more informed, please give us a thumbs up, as it will help other women find this information when they need it the most. Like I said from the beginning, subscribe if you haven't already done so, as we release new videos regularly that will help your health and help you live happier lives. Your future self will thank you for watching. We'll be talking next about foods that can help balance hormones naturally during menopause. And remember, you are not broken, you are not crazy, you are definitely not alone. We see you in the next video. Stay blessed and have a nice day. Thank you.